Multiple myeloma is a kind of a blood cancer which starts from the bone marrow. We have been producing 100,000 cells every day and 100,000 cells die every day. Now understand, if 400,000 cells are being formed and only 100,000 cells die, what happens? They get crowded and these are called plasma cells. These plasma cells get crowded in the bone marrow, leading to low hemoglobin. Because of the crowding, hemoglobin cannot be formed. When they become crowded more and more, they break the bone, by which the people goes to the orthopedicians to find why they have a fracture. Through the bone which are being broken, the calcium gets released and chokes the kidney. So if you have unexplained renal failure, you have got pathological fractures, you have got fracture in the spine, or you have got low hemoglobin beyond 50 years of age, start thinking of multiple myeloma. The test which is required to confirm multiple myeloma is called serum protein electrophoresis. But what is more important in various countries is to understand that the doctor has to keep a high suspicion of multiple myeloma in patients presenting to unexplained renal failures, pathological fractures, back pain and high ESR. These are the early symptoms for picking up multiple myeloma. Early diagnosis of multiple myeloma is by the index of suspicion. So what is required to do and pick up multiple myeloma early is complete blood counts, serum protein electrophoresis, renal function test, bone marrow aspiration and biopsy. Every suspected patient of multiple myeloma needs to get a bone marrow aspiration and biopsy to understand how many bad plasma cells are there in the body. Multiple myeloma is a non-curable disorder, but the moment we say non-curable, heartbeat starts rising. But at the same breath, we will say it is highly controllable disorder, as we know. In 2001, we had one drug called VAD, but in 2018, we have got 12 new drugs and more in pipelines with every passing year, which is promising to ultimately leading to cure of multiple myeloma. Multiple myeloma basic principle is fix the kidney, fix the bone, start chemotherapy, which is so different in 2018, devoid of any hair fall, nausea, vomiting or diarrhea. Those are called targeted medication, which is one is bortezomib, which is very freely available at an affordable price in India, which tends to control 80% of patients with simple in 2-second push. So remember, bortezomib, steroid has to be combined, and a 3-drug modality, another drug called lenalidomide or thalidomide needs to be added. As we speak in 2018, in last 1 year, India has been fortunate to get 3 new drugs called pomalidomide, daratumumab and calcifizumab, which is at the 1/10 of the price from any European or American countries. So as we understand, multiple myeloma is a non-curable disorder. The only way to prolong life in multiple myeloma is chemotherapy, followed by bone marrow transplant. We do bone marrow transplants up to 65 years of age, and this is called autologous bone marrow transplant, which is not expensive and affordable for majority of patients. As the article got published in NEGM saying it prolongs the life by 50 months in comparison to 36 months which is being provided by chemotherapy. So it means it gives you an additional life of 16 to 18 months in a patient of multiple myeloma, which is highly curable, because as we move into 2020 or 22, we might have a drug which might afford us a cure, which is called as either a gene therapy, dendritic cell therapy or a CAR T cell therapy. With every passing year, there are new drugs which comes into the market, and the old drugs become more affordable to at this present moment of time. Coming back to multiple myeloma, bone marrow transplant, up to 65 years of age, every single multiple myeloma patient deserves to get a bone marrow transplant at an affordable price, which in India at this present moment of time, we have been able to provide to 60 to 70% of patients of multiple myeloma. So the message is loud and clear. Up to 65 years of age, every multiple myeloma patient deserves to get a bone marrow transplant as proven by scientific papers in the worldwide community.